Hello everybody, I'm Dr. Vindhya Pai and today I'll be speaking about warts. In science, it's known as verruca vulgaris. It's a viral infection. It's caused by human papillomavirus. Now there are 150 strains of human papillomavirus and only a few strains can produce this sort of an infection. It's a raised lesion having finger-like projections that can occur literally any part of your body. You can have it on the plain surface of your body, you can have it on your scalp, in the beard region, on your palms, soles, in the vaginal mucosa and in the genital mucosa too. How is it spread? It can spread by auto-inoculation, which means especially if it's on your beard region and when you shave, these viral particles can spread to neighboring skin and can produce hundreds in literally a few days. If you have even a single wart, I suggest you go and treat it immediately because it can spread like wildfire. The other way of spread is by close contact, which means if you have abraded skin or injured skin and if you touch infected surfaces having these viral particles, you can easily get infected. Or it can also spread from one person to another, especially if you have lowered immunity or if you have injured skin. Also, in the genital mucosa, it can spread by sexual contact. How does it appear? It appears as raised finger-like projections or as plain topped surfaces. How is it treated? If these warts are present on the plain surface of your body, it can be treated by electrocautery or by using a radiofrequency machine. We can just cauterize it. Another way of treating it is by using salicylic acid, especially when it is on the plantar surfaces. It can look like a corn. So usually we give them salicylic acid preparation to remove off the dead cells, the upper layers of the skin, and to soften the wart. But if it is present on the palmar or the plantar aspect of your body, then we need to use cryotherapy or a liquid nitrogen spray treatment. It's a cold spray of liquid nitrogen at minus 196 degrees Celsius. So we use a series of freeze and thaw cycles, at least 3 cycles of freeze and thaw to freeze this virus and to kill it at the cellular level. Usually after treating the virus in this way at a series of maybe 5 or 6 cycles, the virus never returns back. But virus stays in our body as latent particles, and whenever our immunity is a bit lowered, it can recur. But I suggest whenever you see a wart on your body, just treat it immediately because it can spread. It can affect any age group, from children to middle age to older age group. It can affect literally anybody. And while we are doing so, while we are pairing the wart, we can notice whether it's a wart or a corn, because if it's a wart, you can see some clotted blood vessels, some red dots there. So that means that it's a wart, and we can easily treat it later by using cryotherapy. So this is how we differentiate it from a wart and a corn. I hope you enjoyed watching this video. Thank you.